All right, excellent. Well, thank you very much, Mary, for agreeing to do this interview with me. It helps a lot for me to help educate other people who are maybe in your same situation, health-wise, struggling with whatever chronic health conditions they've been dealing with and haven't been able to find the help they're looking for in the medical system. So thank you again very much for doing this. So let's start with the first question. First, what is your name and what brought you into our office?
My name is Mary Lontkowski, and I was struggling with my health for years. I was experiencing diabetes that was uncontrolled. I had a major heart attack in 2020 during the height of COVID, and then my thyroid started giving me issues, and it just was one thing on top of the next, and I was frustrated, and the medical system really wasn't helping me, especially with the thyroid issue that I had. I went in to get help. I was given yet another pill, and then it turned out that I was allergic to that pill, and then they didn't really know what to do with me, and I just felt terrible. And I actually was sitting out in the back porch of my house, and at one point I was just contemplating whether it was really worth living like this, because it had been years since I felt well, and I just got frustrated. So I clicked on Facebook at that moment, and you popped up, and I said, okay, that's a God thing. It's time for me to do something.
Yeah, some sort of divine intervention there, right? Or something of the sort. Well, that's great. And like you mentioned, you had a team of specialists you were working with, right? It's not like you weren't being active or proactive, I should say, to trying to find the help, right? You had specialist after specialist after specialist and multiple medications for each ailment that you had. And you were just still not feeling well, right?
Right.
And so when you did see our ad pop up on Facebook, what motivated you to join our program specifically?
As I was saying, I was just really fed up with the medical system. I couldn't get help. All I ever got was another pill. At one point I was on over 20 prescriptions, and I still just felt terrible.
Yeah.
And I wasn't enjoying life. There was no quality of life. I couldn't do anything I wanted to do. I had no energy. And I saw this, it was a fresh approach. It was something different. It wasn't, I could tell it wasn't just give me another pill. It was, time to make a change in my life. And so I said, you know what, I'm going to give it a chance. So it was a free consultation that you had offered. So I thought it's not going to hurt anything to go in and try.
Yeah, 100%. And like you said it best, you were ready for a change, right?
I was.
And so that was the big determining factor, because we consult with a lot of people who come in just to take advantage of the free consult, but they're not ready to make the change. And so it ends up not working out, and we end up not working together, but you were ready to make that change. And so props to you for doing the work. Now, let's talk a little bit about the program. What in particular do you think helped you the most, and why was it so effective for you?
The program, first of all, the beginning part of the program, when you explained everything to me, you were able to clearly explain to me what was going on in my body, what wasn't working, how you could, how we were going to go about changing things. So helping me to understand, rather than just telling me, eat this or don't do that, you really explained to me what was going on medically with me and in my health. So that really was the first step, was just truly understanding what was going on and seeing a light at the end of the tunnel. Therefore, if you understand something, you can figure out how to get to the, through the problem of it.
Yeah.
And then just having all the structure of the program, so that the program set clear boundaries and clear structure. It made it easy for me to just say, you know what, this is a defined amount of time, and there was a lot of structure to it. So I just figured, you know what, I can do this for a certain amount of time. It's not a forever thing. You go on a diet, and who knows how long till a diet's going to take effect. But this was a clearly defined, this is how many weeks you have to do it, and this is what you have to do. And so it was just something I really didn't have to think about. I just had to do it.
Yeah, absolutely. And so there were a couple pieces I think were absolutely crucial to your progression. And one of them was having frequent check-ins, right? Once a week, we would meet partially as an accountability check-in, right? And that was very useful for you. You want to elaborate a little bit on that?
Yes, absolutely. The accountability was the biggest factor for me. Just having to be able to come to see you or talk to you over the phone the next week and say, here's what I've done, or here's what I haven't done, and this is how I've done, really gave me the motivation and the gave me the motivation to stick with it.
Well, the accountability too, right?
Accountability.
Knowing that you were going to have to give me a report of how the previous week went, right? And then the other big piece I think that was very effective to keep you motivated was we would do a new blood test about every 6 to 8 weeks, and you could see in real time that progress of the work you were putting into it, right?
Absolutely.
And I think that is very beneficial for most people when they can see the numbers start to change in as little as 6 to 8 weeks, right? As long as you're putting the work in, we usually see the progress pretty quickly.
Well, and for me, I was off of insulin within the first week.
Right. That was a shock to me too, but that was a huge win just in the first week.
Yeah, getting the results definitely made me motivated to keep going.
Absolutely, 100%. And so you mentioned you got off the insulin in the first week, but as a result of implementing the program, what I think we've done around 12, 14 weeks at this point, if not longer, what has been the result now, this many weeks in?
I feel like a completely different person. I used to sleep all the time. I would sleep as much as 18 hours on a weekend day. And I no longer have the need to do that. I still sleep at more than probably 8 hours, but it's not 18 hours. I feel good. I have energy.
Awesome.
I feel better about myself. I've lost weight. And I don't feel sick anymore.
Yeah.
And it's made a world of difference for me.
Yeah, 100%. And you no longer have that question of, is it worth continuing to live in this state?
That's right.
Right. Like you did before. Now the big factor that really motivated kind of this interview was you called me this week after having a visit to your cardiologist. Why don't you elaborate a little bit on how that visit went?
Oh, the visit was fantastic. I saw first a physician's assistant comes in and kind of checks me over and talks with me a little bit. And she was just astounded at the changes that I've made in my life and all of my blood work numbers and my weight loss. And so then she went out and she shared a little bit with the doctor, and he came in and he checked me over and he said, wow, it looks like you really, made some good progress. And I said, yes, I have. And he went out of the room for a minute and he came back. And when he came back in the room, he sat down on a chair, which he never has done before. So he sat down in the chair and he looked at me and he said, well, I have to tell you, as a medical professional, this, what I've heard that you've done is a bunch of hogwash. But you're sitting in front of me and I've seen your blood work and I've seen the results. So I have to find out what you did. And so I told him about the program and kind of what you explained to me and what I learned and how we went through the process. And, basically he was still pretty skeptical, but he couldn't deny. He says, I can't deny this. He said, medically, this just does not make sense. And I said, you know what? Then medical doesn't make sense, because all I've done is come here to get another pill and another pill and another pill. And it didn't get me anywhere. I was still feeling horrible. So this, this lifestyle change that I've made it's made a
game changer. Yeah, game changer for you, 100%. And this was the same cardiologist who treated you after your heart attack, right?
It's one of the ones that treated me.
One of the ones. Okay. Yeah. And he's been managing like all your meds since then, yeah?
Yeah.
Yeah. Yeah. Okay. Yeah. So he was there, at the worst of it, and he's seen your progression through to now. So that's a big, maybe we can say we've maybe slightly converted him in a way. Now, where do you think you would be right now if you hadn't taken action and put the effort and time into the program that we kind of laid out for you?
It's something I don't even want to think about,
Yeah,
honestly. But I know
100%.
I'd be very, very sick. I'd be very
Mhm.
depressed.
Yeah, yeah, enough
I
said.
mean, on to the next health issue. They just kept coming one after the other. And I
Yeah,
just, no matter what I tried to do, it didn't work. Nothing was helping.
yeah, yeah. Well, I'm so glad you're feeling so much better now. Now, last question. For anybody out there who's kind of on the fence about taking advantage of the free consultation or coming in to see us, or skeptical about, making diet and lifestyle changes to improve their health, what would you say to them?
It's absolutely worth it. It was hard. And I think I told you several times that I didn't think I could do this program. After I came in for
Oh,
that
yeah.
free consult, I walked out and I actually was driving home laughing, saying, there's no way I can make all these changes and do all of this.
Yeah.
But it did. And, once again, I think it goes back to because I understood why I was doing it and I could
Mhm.
see the benefit that it was going to get me. So I would say to anybody that's thinking about changing their health or, thinking about coming in for a consult to definitely take that opportunity and take that step and come on in.
Yeah, absolutely. And it's so common, like you alluded to earlier, that a lot of people underestimate, even medical professionals underestimate the power of diet change, targeted nutrition plans, and lifestyle modification to improve overall health. And you're the perfect example of that. And thank you for sharing your story with anybody out there who has the ears to listen.
Well, I certainly want to tell whoever's listening, it's worth it. It's absolutely worth it. And I feel like a completely different person. I'm so
100%.
thankful that I found this program.
100%. Well, again, thank you very much, Mary, for sharing your story. And we'll be in touch very soon.
All right. Thank you.
All right. Bye-bye.